Hi, good evening, Facebook. So today is day 22 of my mental health awareness challenge, and it's getting exciting with each passing day. So we are now on the home run. So yesterday's video was on sleep and mental health, and today I'm going to be talking about schizophrenia. That's what I said I was going to talk about, and that's what I'm going to do. However, just to give you a bit of a gist of what's going to happen in the next few days, because the next few videos are really going to be exciting as well. I think I'm on a home run, like I've said. And so tomorrow I'm going to be talking about stress and mental health. And then the day after, I'll be doing social media and mental health. Social media and mental health actually comes on a popular demand, and that's because particularly people are concerned about young people and the impact that social media use is having on their mental health. And finally, on day 25, which is on Thursday, I'll be doing a video on thinking habits and mental health. And I really do think that that's probably going to be one of the most insightful video that I'll be doing in this series. And that's because in modern day, we are taught what to think, but not how to think. And really thinking is a skill. So people try to teach you what to think, but not how to think. But we can actually learn how to think in order to master our mental health and mental well-being. And so that's a video I'm really looking forward to, because that's an area that has worked for me. I've put it to practice in my life. It's worked, and I'm very keen to share it with other people as well. And also because I do know that it gets results. So that's what the next 4 days will be looking like. And I really do appreciate the fact that you've stayed with me all through this period. So schizophrenia. What is schizophrenia? To start with, schizophrenia is a word formed from two words, and they are from two Greek words, schizo, which means split, and phrene, which means mind. So basically, schizophrenia means split mind. And very earlier on, I want to attack the myth about schizophrenia. A number of people believe that schizophrenia means split personality, which it's not. So they think somebody who has schizophrenia is somebody who is so unpredictable in their behavior. Today they behave one way, or 1 minute they're this way, the other minute they're up, and 1 minute they're upbeat, the other minute they're low in mood, or they're just all over the place. That's not schizophrenia. Schizophrenia actually means split mind, and what it means is it describes the turmoil in the minds of people who actually suffer from the condition. So schizophrenia is one of the many forms of the umbrella term called psychosis. It's a form of psychosis, and psychosis can be caused by many other things apart from schizophrenia. But psychosis is simply losing touch with reality. So psychosis is a form of mental illness, a severe form of mental illness in which the person who suffers this experience actually loses touch with reality, in terms of the fact that the experiences that they have in their minds, or that they have in their feelings, or in their behavior, or in their emotions, are not in keeping with what's real. So they are having problems differentiating between what's real and what is not. That's what psychosis is. And schizophrenia, like I said, is a form of psychosis. There are other causes of psychosis. Perhaps in the future, I'll be doing a video on psychosis. However, schizophrenia. So what do we know about schizophrenia? I've said that there's a common myth that people have, that is split personality. The other myth that people have about schizophrenia is that people who have schizophrenia are violent. That's also a myth that is not based on reality. It's not based on facts. We in fact know, for instance, putting things in perspective, that indeed people who have schizophrenia may just have a little more risk than members of the public to be involved in violence. However, the reality is that, putting things in perspective, people who have schizophrenia only become more at risk, either because they've used alcohol or they've used substances. But more importantly is that In the UK, for instance, about 600 murders are committed annually. 600 murders. Out of all those, only 30, that's 5% of that total figure, is actually attributable to people who have a mental illness. So that's really putting things in perspective. It means that 95% of the murders that take place in the UK are actually not committed by people who have mental illness. And that's something to note. So it's really very derogatory and stigmatizing to assume that people who have schizophrenia, who have a psychotic illness, are the people who go around attacking people. That's not correct. The other thing that people don't, the other myth that people have about schizophrenia is that it's a condition that people do not recover from, or that people have a lifelong, that it's a condition that people never recover from. And that's also not particularly true, because we do know that if you have 5 people who have a diagnosis of schizophrenia, 1 out of those 5 within a 5-year period will actually become better. Within a 5-year period, 20% of those who have schizophrenia will become better. Also, we know that 3 out of those 5, that's 3 out of the 5 of that cohort, would also become better. However, there might be periods in the future that they would have, their symptoms will worsen again, and then they will recover again. However, it's only 1 out of those 5 who have troublesome symptoms that last for a very, very long time. So really, the way people think about schizophrenia, that it's a lifelong sentence, or it's a lifelong sentence that puts people, that makes people's life, that messes people's life up, and they are not able to function in society, is not particularly correct. So what are the symptoms of schizophrenia? We do know that the main symptoms are to do with the way people think and the experiences that they have in terms of their in terms of the experiences that they have. So in terms of the thoughts, people might experience what we call delusions, in terms of their false beliefs, but they are so believed, so tenaciously held, so firmly held by the person who believes them, that they don't believe that their beliefs are false. So they might believe that the MI5, for instance, is after them, or that the MI6 is after them, or that there are some spies around their home spying on them, or that there are people out there who are out to get them, or that there are people from space who are following them around. And these are false beliefs. Or they might even believe that some part of their bodies have been stolen away, or that people are breaking into their homes and stealing things. All sorts of it could be about persecution. It could be about even that their thoughts are being taken away from their minds, or their thoughts are being put into their minds, or that they're being controlled, that parts of their bodies are being controlled. But these are false beliefs. They are not based in reality. The other thing that people with schizophrenia also experience is what we call hallucinations. Hallucinations are experiences that are without sensation. So somebody feels an experience. For instance, they might hear a voice, or they might feel things crawling on their bodies, or they might see things, but in actual sense, those things are not there. So they have experiences, but there's no stimulus to actually back it up. So they hear voices calling them derogatory names. The voices might give them commands. The voices might make commentary on their actions. But all of these, other people don't hear the voices, because it's only because they're unwell. That's why they hear those voices. Or some people might feel that somebody's touching them, or somebody's pushing them, or that, or they see things. All of these are experiences that people have when they have schizophrenia. The other thing that is common is that they are modeled in their thoughts, in their thinking. Sometimes the way they talk, it's very difficult to follow their speech because of the modeling of their thoughts. And and during the periods of crisis, they can also be agitated, they can be hyperactive, they might have problems with sleep. Their moods might also, because of the distress of the experiences that they are having, they might also have mood symptoms in terms of poor appetite. They might neglect themselves. They might not attend to their personal hygiene. All of those could happen with schizophrenia. How common is schizophrenia? We do know that about 1 in 100 people, it's about 1% of the population have the condition. We also I suppose the question you want to ask is, what then causes this condition? Why do people have schizophrenia? We do know, for instance, that there is a genetic component to it, that there is a part of it that is inherited. So we do know, for instance, that if somebody's parent has schizophrenia, they stand a 1 in 10 chance, a 10% chance of having schizophrenia themselves. However, the general population is a 1 in 100 chance of having schizophrenia. So if somebody's one parent has schizophrenia, it's a 1 in 10 chance. However, if somebody's brother or sister has schizophrenia, they stand a 1 in 8 chance, so about a 15% chance, which is higher than if it was a parent. However, if an identical twin has schizophrenia, it's a 1 in 2 chance, a 50% chance. So really, and in my experience, I've seen twin sisters, I've seen quite a couple of sets of twins who both had schizophrenia, who both had a psychotic illness. So it just tells us how much the gene plays a role in schizophrenia. But in addition to that, one of the other things that is also commonly known to cause schizophrenia or to be associated with schizophrenia is what is called birth injuries. If there's any injury to the brain of a child, either whilst they're in the uterus, that's either because of viral infections that their mother had whilst they were pregnant with them, or maybe because of birth injuries in terms of difficulty at birth, when maybe maybe this was a prolonged labor, or for one reason or the other, maybe they aspirated during birth, and because of that there was a shortage of oxygen to their brain during the delivery period. That could also that's also been associated with schizophrenia. We also do know that things like cannabis use, amphetamine use, drugs have been associated with schizophrenia. What is not really known is whether these drugs actually cause schizophrenia in everyone, or whether they make it they trip over the people who already are vulnerable. But we do know that the more cannabis that is used, the stronger the type of cannabis that is used, and also the earlier the person starts using cannabis, the higher the risk of developing schizophrenia. So really, the figures show that if somebody who is a teenager has used cannabis up to 50 times in their lives, in their teenage years, they are 6 times more likely to develop schizophrenia than Joe Bloggs on the streets. So that's another reason to really help our young people to stay away from drugs by all means. So in terms of, we've talked about the other thing that could tip people over is stress. And that's usually stress. It could be housing, it could be monetary problems, it could be bereavement, it could be a life event, even moving homes. Usually we know that stress is usually what tips people over, and it's usually people who are already predisposed, who are already carrying it in their genes, or who are already at risk in one way or the other. Stress could then be what then makes them manifest the symptoms for the first time. So in terms of what's the treatment, we've talked about what the symptoms are. What's the treatment? Like, psychotic illnesses are usually treated by secondary care mental health services. By that I mean, most psychotic illnesses are not treated by GPs, but the GP will usually be the first place to go to. So the GP is the first place to go to, but when it comes to really the treatment, most times it's treated by specialist mental health services, which it could be community mental health service. Sometimes people also have to be admitted into hospital, and the first thing to do is to really speak to the GP or to the family physician. And I want to emphasize here the import or the importance of early intervention in getting help as soon as possible. There are 4 things at least that we know that is better if people get help quickly. 1, we know that they are less likely to be admitted in the hospital, because it's only the severe form of psychosis or schizophrenia that goes into hospital. So people who get treatment early are less likely to be admitted in the hospital. Secondly, we also do know that people who get treatment early, if they get admitted into hospital, they spend less time in hospital. So their period of staying in hospital is quicker. And we do know that even if they don't go into hospital, or if they go into hospital, they are likely that when they get back home, they are going to need support is less. So they are usually able to then go back to their normal life and without support. The other thing we do know, the fourth thing we do know is that they are also, the quicker you get help, the more likely you are to be able to return to work and to be able to live independently. So really, if there are symptoms of psychosis, the important thing to do is to really get help as soon as possible, because with each day that passes, you are losing time. The recovery is getting more and more jeopardized. So that's the reason why it shouldn't really be swept under the carpet, or it shouldn't be shrouded in secrecy. People should get help. So in terms of treatment, what are the treatments available? Antipsychotic medication is the main treatment, but there are other talking therapies that are available as well. Antipsychotic medication could be in form of tablets or capsules, in form of tablets, or it could also be in form of injections. Usually injections are not usually used as first line. They are only used when people don't remember to take their tablets, and as a result they become unwell again. And the other thing to remember is that when somebody suffers a first episode of psychosis, that is usually treated aggressively. Usually psychiatrists will usually recommend that somebody stays on medication for quite a period of time. So, and usually it's not months but a few years. And the reason is because the risk of then getting another episode is less if they stay on medication for that long period. The advice is usually not to stop medication without consulting with your clinician, with whoever prescribed the medication in the first instance. So what are the other forms of treatment? There's talking therapy, cognitive behavioral therapy, that helps people to think in a different way about the thoughts and the experiences they are getting. That also helps. We do also know that people can be supported in their vocation to return to work, to learn a skill. We also know that social interventions in terms of people getting help with their housing, with their benefits, all of those really do help. We also do know that sometimes when people have what is called negative symptoms of schizophrenia, the symptoms I described earlier about hearing voices, thinking people are after them, are positive symptoms. They are called positive symptoms. But negative symptoms has to do with poor motivation, poor concentration, not neglecting themselves, just not feeling like engaging in anything at all. And that's not because they are lazy. It's actually the symptoms of the illness. And sometimes people need rehabilitation. They go into it's a unit in which they actually helped to develop the skills of living again, the skills of taking care of themselves, washing themselves regularly, cleaning, maintaining their environment, doing things that they've been able to do before. So sometimes as well, rehabilitation is required in helping people with schizophrenia. So that's about much that I wanted to say about schizophrenia this evening, and I hope that you found it of benefit. Please do, let's get the conversation going. Please make comments. Let's just keep the conversation going, and let's support the people that have this condition or people that need to get help. Once again, it's really talking to your family physician or to your general practitioner. I look forward to tomorrow's video and the last few videos. Thank you for listening, and do have a good evening.